Hi everyone, I'm Dr. Sue, Cancer Vet. Welcome back to the vlog. If this is your first one with me, welcome. If you're returning, thanks so much for joining me again. Today is going to be a 3-part series all about splenic tumors, so masses in the spleen. And there can be a tough one because often if you're told that your dog has a mass in the spleen, we often don't know what it is until we go to surgery. So there's so much information for me to break down that I'm breaking it into 3 parts. So let's kind of highlight what we're going to talk about in the 3 parts, and then we're going to dive into this one. So in the first one, we're going to do an overview. I really want you to know not every mass in the spleen is hemangiosarcoma. It's definitely the most common one, but all masses in the spleen are not hemangiosarcoma. So we're going to talk about the 2/3 rule and what some of those other masses are, and when can we be more suspicious that it might be hemangiosarcoma, and when we might be less suspicious that it's hemangiosarcoma. But ultimately, guys, we don't know until we take our dogs to surgery what that mass in the spleen is. And that's really frustrating. So we're going to talk about that. In part 2, we're going to talk about hemangiosarcoma, which is the most common malignant tumor that we see in the spleen. And we're going to break that all down for you. In part 3, we're going to talk about treatment and prognosis for hemangiosarcoma. So 3 parts. Let's break it down. Let's do it. All right, I have a couple of tips for you when it comes to masses in the spleen. So as I mentioned in the introduction, you know, often a mass in the spleen, it's hard. So if you know me and anything about my lumps and bumps program, I'm a big advocate of finding out what a mass is before we go to surgery. And the hard thing about these masses in the spleen is that we're often have to take our pets to surgery to find out what they are. And all too often, I hear it's hemangiosarcoma, it's not worth going to surgery. And I want to dispel that myth. So I have a couple of tips and tricks for you. So number 1, guys, all masses in the spleen are not hemangiosarcoma. Number 2, if your dog has an ultrasound and they see nodules in the liver, we can't automatically, based on appearance of those nodules, say it's metastatic hemangiosarcoma or hemangiosarcoma that has spread to the liver. Just like that primary mass in the spleen, we're often going to have to go to surgery and get biopsies of that. Even the surgeon, your veterinarian at surgery, cannot tell with their eyes what those masses are. So nodules in the liver and the spleen at surgery, we can't tell the hemangiosarcoma that has spread or metastasis. Another myth out there about hemangiosarcoma is that if there's a large mass in the spleen or the liver, it automatically means that it's malignant. And that's not true. And there are studies that show that often the large masses are the benign ones. So again, you don't want to make a life or death situation based on the size of a mass. So just because it's a big mass does not mean that it's malignant hemangiosarcoma in your dog's spleen. There's a study that came out in the last couple of years that says that incidental masses in the spleen are more likely benign. What do I mean by incidental? We'll go through this a little bit later, but that means if your dog's getting an ultrasound for something else and they happen to find a mass in the spleen, that is going to be less likely to be hemangiosarcoma than some of these other masses in the spleen. And the other thing I really want you to know, guys, is hemangiosarcoma is a treatable cancer. It's still a tough cancer. You know, when we look at the survival times with surgery and with chemotherapy, they're not as good as, I'll be honest, as other cancers like osteosarcoma and lymphoma and mast cell tumors. But we do improve survival times with treatment, but it's still a tough cancer and we need better treatment options. And I'm excited that there are some new therapies out there being studied. We don't have a cure for it, but it is a treatable cancer. So that's what we're going to break down in this first video and the upcoming 2 videos. So let's start to do it. So I keep saying it's not always hemangiosarcoma. Do I have the facts to back that up? I do, guys. So there's something called the double 2/3 rule for masses in the spleen. What do we mean by that? If a dog has a mass in the spleen, 2/3 of them are malignant. And of those malignant ones, 2/3 of them are hemangiosarcoma. And so 2/3 of 2/3 is about 44%. So to simplify it, in general, about 50% of dogs with a mass in the spleen are going to be hemangiosarcoma. So again, 2/3 are malignant, and of the malignant ones, 2/3 of those are hemangiosarcoma, and again, 1/3 of those are going to be benign. So we're going to talk more about hemangiosarcoma in part 2 of this, but I know a lot of people are watching this and it is the most common one. So I do think it's worth just touching on some of the key points of hemangiosarcoma. Again, it's not the only tumor that we see in the spleen. If your dog has a mass in the spleen, it's definitely the most common. It's, as we say, it's locally aggressive. So it's really, it's aggressive. It's gonna, start to grow pretty quickly in the spleen, and highly metastatic. So it gets into the bloodstream and will spread to other organs. So the liver and the lungs are the two most common places that it spreads. So the other problem with this tumor is that it's a tumor of blood vessels. So often these tumors are very cavitated and filled with little chambers of blood, and these can rupture. And when part 2, when we talk about the symptoms that these dogs have, the reason this is such a devastating cancer for so many owners is often the first time that we find out that our pet has hemangiosarcoma is when it ruptures and they have something called a hemoabdomen, where they're bleeding into their belly. So even though we don't see them bleeding, they're collapsing because they're losing that blood out of their bloodstream into their abdomen. The hard part, the frustrating part for pet owners is we don't know the prognosis for a dog with a splenic mass until we take them to surgery and we get back that biopsy, which can often take 3 to 5 to 7 days up to a week. And that's when we know the diagnosis, and that's when we know the prognosis. And as I mentioned in the introduction, the size, what it looks like at surgery, what it looks like on ultrasound are not going to be good indicators that your dog has hemangiosarcoma or something benign. Treated dogs do live longer than untreated dogs, but 1-year survival rates are still very low compared to some of the other more common cancers like lymphoma and osteosarcoma, where their median survival times are often a year. So they do live longer with treatment, but the 1-year survival rates are very frustratingly low. Both as an oncologist and as a pet owner, I agree that the 1-year survival rates are very low. Okay, so let's talk about some of the other masses that we do find in the spleen. So I said 1/3 of the masses are benign. That would be great. Those are some of my favorite phone calls to make. So there are non-cancerous masses that we see in the spleen. That could be a hematoma, or that could just be an abscess. Sometimes we just see something called nodular hyperplasia. That would be something else that's benign. But we could see granulomas in the spleen as well. So these are all non-cancerous things that we see in the spleen. There's also a benign tumor called hemangioma. So again, those typically make up for about 1/3 of the non-malignant masses that we see in the spleen. Okay, we said 2/3 of the masses that we see in the spleen are malignant, but they're not all hemangiosarcoma. They're not all made of blood vessels. So what are the other tumors that we see in the spleen? And I do get a lot of messages from pet owners who have their pets have less common tumors, that they're often frustrated that they can't find a lot of information on the internet or on YouTube or on my YouTube channel. So I am going to spend a few minutes going through some of the other malignant tumors that we see in the spleen. We have lots of blood vessels in the spleen, so when they become malignant, that's hemangiosarcoma. We have lymphoid cells, so we can get lymphoma. There are normal mast cells, so those are inflammatory cells, so you can get mast cell tumor in the spleen. There's a lot of connective tissue that holds the spleen together. When that becomes malignant, you can have something called a fibrosarcoma or some of those other connective tissue cancers. And then there's smooth muscle that helps the spleen contract. And when that becomes malignant, there's quite a mouthful. It's called a leiomyosarcoma. Osteosarcoma I've seen in the spleen as well. So extraskeletal, outside of the skeletal system, osteosarcoma as well. And then sometimes we see something called undifferentiated sarcomas as well. So you would think, well, these must be better, right, than hemangiosarcoma, because that's the worst. They can be better, but often a lot of these dogs, getting them out to the 1-year anniversary can be a challenge as well. Tumors like leiomyosarcoma, the smooth muscle malignant tumors, do also have a very high metastatic rate. So after the spleen is removed, after splenectomy, I do recommend chemotherapy. I definitely have dogs that get to the 1-year anniversary, but it's not like, ooh, they're super fantastic, better than hemangiosarcoma. They still are aggressive, and they still typically are going to require chemotherapy afterwards. Lymphoma is going to be one that we're definitely going to recommend chemo, and mast cell tumors as well are going to be ones that we're going to recommend chemotherapy as well. Another one that we often see involving the spleen that can have that sort of mass-like appearance, but often multiple masses, would be malignant histiocytosis, which is a cancer that is often, we see more commonly in Bernese Mountain Dogs and Rottweilers, but it's often multicentric, so we see in multiple organs like the liver and the lungs, sometimes the spleen, and some other organs like that as well, including the bone marrow, sometimes the skin as well. So again, there are other malignant cancers that we see in the spleen, but we're going to spend most of our time talking about hemangiosarcoma in the next part. Before we get to that, I am going to mention in this video some of the symptoms that we see, because I think that's really important, whether it's hemangiosarcoma or any of the splenic masses. So let's talk about some of the symptoms that you may see with a dog with a splenic mass. So what do we typically see with a dog that has a splenic mass, whether it's hemangiosarcoma, something benign, or one of the other malignant tumors that we talked about? It can really vary, and that's, again, one of the challenging things with these dogs with masses in the spleen. So sometimes they're going to be vague and non-specific, and you're going to be shocked to find out that your dog has a mass in its spleen. Sometimes their abdomen will be distended or enlarged. They're not eating that well. They can be tired, depressed, weak, sometimes even some vomiting and diarrhea. And then sometimes, as I mentioned, they're bleeding into their belly and they're bleeding into their abdomen. So it can be really, really dramatic. They can collapse, their gums can be white, and they can be in something called hypovolemic shock. And that's because, again, they're bleeding into their abdomen, and they lose that blood from their blood vessels from their vascular system. So again, it can be really dramatic, from just not eating so well to hypovolemic shock, and they need to go, in on emergency. The other interesting thing with some of these dogs with bleeding masses is sometimes they're bleeding very slowly, and they'll bleed a little, and the dogs will actually absorb that blood. So they auto transfuse themselves. And so sometimes the owners will look back and say, a couple of weeks ago, Duke was a little bit off for a couple of days, seemed kind of sluggish and tired, and then kind of perked back up. And sometimes we'll run blood work and we'll see that their anemia is regenerative, and they're showing signs that they had an episode where they were anemic, but they're making more red blood cells. So again, sometimes if they have a slow bleed and they can absorb that blood and transfuse themselves, it's better. But it's when they have a big dramatic rupture of that splenic mass and they're bleeding so much that they can't absorb it that quickly, that's when they're going to need to go to the doctor, to the veterinarian, and often it's on emergency, and then things get really accelerated quite quickly. When you go in on, to your veterinarian, whether it's during, regular office hours, or if you have to go to the emergency clinic, your veterinarian, the ER doctor, often they'll feel the abdomen. Sometimes they're going to be able to feel a big spleen. They may be able to support that with radiographs, x-rays, an ultrasound is definitely preferable, as we'll talk about a little bit more in part 2. There is, we were talking about in the beginning of this video, like, when can you raise your index of suspicion that that mass in the spleen is hemangio versus something else. There was a study, remember I said it's about a 50-50 split, right? 2/3 of 2/3 is about 45%, and studies do show that about 45 to 65% of dogs with a mass in the spleen are hemangio. But if your dog is bleeding into their abdomen, again, that's called a hemoabdomen, and no history of trauma, so they weren't hit by a car or anything like that, it actually goes up to 80 to about 85% that it's going to be malignant and hemangiosarcoma. So again, that's why emergency vets that I know work with say, oh, a dog with a splenic mass that comes in on the ER is always hemangiosarcoma, because they're usually seeing the dogs with a ruptured splenic mass. So that does have a greater likelihood of being hemangiosarcoma versus an incidental mass found in the spleen, or a non-bleeding mass found in the spleen, which could be one of the other tumors we talked about, hemangioma, or maybe 1/3 of the benign things that we talked about. So again, still not going to know until we go to surgery. So they're tough cancers, they really, really are, because again, you know, one of the take-home messages I really want you to know from this part 1 is it's not always hemangiosarcoma. You're gonna need to go to surgery to ultimately know what the diagnosis is for your dog. But I do hope that you found this helpful. Please come back for part 2, where we'll be focusing on the different tests and a little bit more detailed in-depth dive into hemangiosarcoma. We'll be talking about some of the tests that you're going to be discussing with your veterinarian, what we commonly see on those tests, which are the ones that you definitely want to do before surgery, and which are the ones that you can probably decline, especially if you're working on a budget. And then in part 3, we're going to talk about treatment beyond surgery. We'll talk about some supplements that have some interesting studies on them, and some new treatment options and studies that are in the work, which I'm really, really excited about, and the prognosis as well. So come on back for part 2 and part 3. Please leave comments. Did you find this helpful? What have been your experience with this cancer? I know it's a tough cancer. It sucks, it does. But again, I'm here to give you options and hope, and I hope that you found this helpful. Please come on back for the next video. Thanks for watching.